During rhinoplasty consultation, we sit down and we discuss your goals for your nose, and then I take a look inside. The reason being is I want to help create noses that not only look beautiful, but work for you and your life. Athletes need to breathe, people need to get on with their lives and not be sniffly or stuffy or blocked on one side. After examining your nose through nasal endoscopy or rhinoscopy, meaning looking inside, we'll take standardized photographs of your nose. And this is really important, but it's also a fun differential point. I like to take pictures at this point of the consultation because I still like to perform digital morphs of the images. Some surgeons choose not to. And so if you're consulting and some surgeon offers you a morph and the other doesn't, there's a reason for it. One of those reasons hinges on creating expectations. As humans, we have, let's say, selective memories where sometimes we hear what we want to hear and not what was being said, or even in other times, maybe someone just didn't communicate it clearly enough and the mutual intent to understand was there. Morphs are not promises of what your nose will look like after surgery. They can't be. We're morphing two-dimensional pixels on the screen. That doesn't act like tissue, it doesn't look like tissue. If there's a shadow on your photo because your nose is crooked, it's gonna be a different colored pixel than the rest of your skin. And so when you morph it, sometimes it looks fuzzy or blurry when you try to get things straightened back out. Reasonable, right? But the pros of morphs are that they can really help communicate an aesthetic and really get that visual alignment of our goals. Luckily, it doesn't happen too often, but I can definitely think of times where a patient has come in and she said she wanted a gentle swoop. Sounds, pretty normal, right? Usually for women, we want a little bit of a break or a little tip, etc. But she showed me her inspiration photos and it was not a little swoop. It was very stylized, a very dramatic swoop. And if I had not been able to communicate that, we could have had issues leading up to surgery, right? So on one instance, there's the whole trust your surgeon. You need to do that. We've invested the time and have the expertise to achieve your goals. There is something to be said about seeing your face changed before your surgery to help make sure we're saying the same things and speaking the same language. With this patient, if I talked to her about how much of a swoop, but in surgery I felt that it was going to compromise the structure of her nose or etc., she could have potentially been really disappointed. And so having these different touch points and seeing the pictures in real time can help communicate those things. So morphs help align where we're going, but they don't set the final destination.